Okay, so let's get started. It's this is Piota's Learning Lunch. I'm the host for today. My name's Chris Elkin. I'm the head of healthcare at Piota, and we've got our guest speaker today, Ash Singal, who is the consultant and IT lead in emergency medicine from Dudley Group of Hospitals. And our learning lunch today is titled "Improving Efficiency and Communication in A&E Departments with the Piota App." So just before I hand over to our guest speaker, Ash, I'm just going to sort of set the scene a little bit. My name's Chris Elkin, and if I've not spoken to you before, I've been with Piota for about 4 or 5 years now, but been in the industry for a long time. Spent a large proportion of my career working within the NHS, producing apps, managing websites, social media, that kind of thing. So kind of well versed from both sides of the fence in terms of app production and engagement and communication with app and patients alike. Really interested in the user experience, and I can't overstate this enough. I think with all of our apps, with everything we do, it's all about making it easy for people. And I think if we can make it easy for people, I think if we can remove that thinking time out of the equation, people are much more likely to get on with it and do whatever it is we're asking them to do in terms of the tasks or in communications or engagement or whatever it might be. So if we can make this thing easy, I think we're on to a winner. Just a quick little bit about us. We're a leading provider of staff communication apps to the NHS. We have about 140 different apps out there in different shapes and guises. We work with the likes of NHS England. We work with Public Health Wales. We work with cancer networks. We work with integrated care systems. We work with trusts. We work with individual teams and everybody else on that kind of spectrum. So we've got a good breadth of experience. We've got a great selection of apps that we've produced in partnership with some of our clients. And part of this process really is to introduce you to what we do. But beyond that, we can certainly demonstrate and show you apps that hopefully are similar to sorts of things that you're looking to provide or looking to supply to your colleagues. So without further ado, I'm going to pass over to Ash Singal. As I say, Ash is the IT lead and a consultant within the A&E team at Dudley Group of Hospitals. So Ash, I don't know if you can hear me, if you want to kind of take over from here.
Will do. Thanks, Chris. Thanks for the intro. So my name's Ash Singal. I developed an interest with IT. I'm not by any figment of the imagination a IT genius in any way. In fact, I know very little IT stuff. But the beauty of the Piota app is just the ease with using it. So what I'm going to do is the reason I developed the app was really about getting that information across to my staff members. And I think one of the biggest problems is we send emails out left, right, and centre. We just hope everything is covered, but unfortunately, it's not. So what is the one communication device that they all use? Probably about 10 hours a day is probably their mobile phones. So they're carrying a supercomputer in their pockets, and they use it day in, day out. So if you want to get your message across, probably through apps is the way to do it. What I'm going to do is I'm going to share my phone screen. So just bear with me, a bit of technology here. And in a minute. Yep, so that is my phone screen. I'll just go down to the app. So this is our ED app here at the emergency department in Russell's Hall in Dudley. And the idea was to get all that information into one single place and where it was easy, because quite often when you're dealing with patients, you don't have a computer sitting next to you. OK, and that could be if you're in the department, you're in recess, or if you're at home, all of that information is available to everyone in your team. OK, so what we have is we've got what we call tiles here on the app. So you've got 9 tiles that sit on the front. And then on the top left-hand corner, you've got this, what we call hamburger screen. Sorry, I just shut it down by mistake. You've got these 3 horizontal lines, and you can then have further, headings down there. So the top 9 there, starting with adult guidelines, the top 9 there are the 9 tiles which are on the front. but we've got a further 5 or 6 tiles further down, and things like patient information, events, induction, and about us. And what I'm going to do is I'm going to very quickly flick through each tile just to give you a flavor. I could spend 2 hours talking about the app because of the amount of content in it, but I'm going to try and restrict this to about 10 minutes. So starting off with the adult guidelines there, the adult guidelines as it says. So things like we've got is resuscitation guidelines. You can press on that. And if you want to know how to treat, say, anaphylaxis, you can just click into it and the anaphylaxis guidelines will come up for you instantly. As you can see, we've got most of these are Resus Council guidelines, and you can open them up just at the tap of a button. So it is very, very quick. The one big benefit of having the app is as long as you maintain it, you can be fairly sure that the information that is available is the most up-to-date information. What I was finding with our trust intranets was that quite often the information is there, but they don't tend to take off the old information. So all the old information is there as well, and people were picking up the wrong guideline because they were picking up the out-to-date guidelines. We've got our ED guidelines as well. So we've got some specific ED guidelines. And again, these are just PDFs, and you can link straight into the PDF guidelines. We've got medical guidelines, surgical, orthopedics, whatever guidelines you can add into the app, and you just add them as new subtile, subsections into those tiles. So we've got things like, what bloods do I need to use for what test? Yeah, things that sometimes people struggle with and then they can't find the guide. We've got it all there. Our pharmacy information is on the app. Times, stock lists, extension numbers. We've got information about pharmacies and checking stocks in the pharmacy, and then stuff that's common. Things like, for example, is the paracetamol nomogram is also on the app. So as you can see, it's unlimited the amount of information you can add. We've done exactly the same with the pediatric guidelines, that second tab, second tile. And we've got full guidelines there. And again, I've just broken it down into the Resus guidelines. We've got the weight charts, the individual weight charts for our children. Stuff that you need, at hand when you're dealing with these situations. Procedures and guidelines as well is as it says, for all our trust procedures. These are the ones which are relevant to our department. There's a million of these on the intranet for the hospital. You seem to have a SOP or a guideline for almost everything, including wiping your nose. So what I've done is I've just taken the relevant ones and put them into our guideline. Okay, and again, you just tap on the guideline and it opens the actual document up for you. All right, so this is the great benefit. If I'm at home, I'm on call, someone asks me a question, I've got the answers there at my fingertips. Other things we've used it for is like our sickness policy, what staff need to do when they're sick, paperwork, and various other things. The password section I'm not going to show you because it's got our passwords in it, and various other guides, as you can see throughout. I'll explain a few more bits about the sections at the bottom which have got my name on them. The beauty of the app is that you can control every bit of information and who sees it. So there's 4 levels really. There's public viewing, so anyone who downloads the app can view that information. If it's got a padlock next to it, that means it's locked, and you can lock it out to people who are registered on the app. So everyone who's registered on your app can see that information. You can lock it down. Further level down would be you can lock it to groups. So I've locked up a lot of this information to the ED consultants or the ED middle grades, or a combination of the 2 or 3, whatever. Or you could even, as those 2 bits which have got my name at the bottom, a single Excel guide and a single, those 2 tabs are not actually only available to me to view. Okay, and that is just a superb functionality in the app, because it means you can target your audience. The directory is, as it says, it's a directory, but the beauty of this is, as well as emailing, so you can put the person's email in there, so you can actually send an email directly from the app. The other beauty of this is you can call either the individual or any extension in your department, in your hospital. And what we found is by putting the commas in, you can put in the switchboard number, which is the first few numbers there, followed by the commas, and then the extension number. And that the commas just put in a pause. So what they do is they ring the switchboard, and after a short pause, we'll ring the extension. So you can actually ring straight through the switchboard. You don't actually have to wait for switchboard to answer your call, which, as we all know, can take absolutely ages. So I've put in contact numbers for consultants, the other hospitals around the region, and then various extensions. So I can ring straight into my resus department now. I know that we've only got 4 beds in our resus, so I could actually ring through to the individual resus bays from my mobile phone. And again, it's just a straight through switchboard into the extension. And this saves an enormous amount of time. Waiting for switchboard can be extremely frustrating. Alerts are alerts that you send out. So I'll give an example there. We do a newsletter which comes out weekly. So I just send that out as an alert. And what happens is that comes up as a notification on the patient, on the person's, the user's phone. And then they can elect to read it. All the alerts that we send out then end up in this alert section. We try and keep this to a minimum because obviously you don't be, one thing I'd hate is for something like it to be something like Facebook where we're getting 300 alerts a day. These are just probably send about 1 or 2 a week. So try and keep those restricted if you can. Forms are forms that you can create within the app. So these forms actually sit within the app. And we use it for our annual leaves. We use it for our mandatory training notifications to learning and development, and various other forms in there. You can use the forms to say, I've done this, I've done that, I've read this, I've read that as well. They all sit within a database. The responses all sit within a database within the dashboard of your app. And I will show you that in a second. So each one of these forms, you designate who's the recipient of the form, and you can have one or you can have several recipients. So the annual leave one goes to my rota manager and also goes to medical staffing at the same time as well. Okay, so really useful functionality there in the app. Training and CPD is, as it says, training and CPD is just, we've got various training models. We've added our mandatory training on here, and we've put most of our mandatory training online now. A lot of people a lot of the staff will simply not come into the trust to do their mandatory training. So this allows them to do their mandatory training from home, really, which just means our compliance with mandatory training is actually quite high. So other things like we've got all of our training programs on there. So we've got the middle grade teaching programs on there. You can touch on it. It gives you the full program on there. And where it says presentation here, if they click on that, these are just hyperlinks within the app. It takes them to the actual presentation. Sorry about that. So it takes them actually to the presentation itself. Okay, so again, everything is so simple and easy to access. Okay, so we've got our middle grade training program there. We've got the junior doctors, the ED, SD3 trainings, the GP training program as well. And then what I've done is I've just put in extra training material. How do I manage, or where do I get information about how to manage anaphylaxis? How do I do a arterial blood gas? Okay, you can also upload videos into this. So these are just links, and usually the links will be to so that just takes you either to YouTube or Vimeo. So you can put in that, how to read ECGs. Where is it? There. Information about ECG libraries and things. So it's absolutely unlimited. And I'm not going to go through every single one, but as you can see, there is a huge amount of training material that we've uploaded into our app. Rotors, they've got direct links to the rotor. The rotors are held in the cloud, and these are just links that give them direct links into their rotors. They can open them from the app itself. We've locked it down so it's view only and not edit because of the risk of them making mistakes from the phone. So we've got the rotors through links, and we've got various rotors in the system. Useful links is just useful links, things like information about the DVLA. We have backdoor telephone numbers for our GPs, so we don't have to wait for their switchboard. So again, it's held in a database there. And there's various other things, links to various websites. And other than, really useful things is things like Medusa. So I wrote to the owners of Medusa and just said, can I have a backdoor into Medusa so I don't need to use a username and password? And they were quite happy to supply that for us. So now I don't need a username and password. It's just straight into Medusa. Clockspace as well, I've got on there as well. And again, it's a quick thing because I'm using it on my phone. I can save my passwords. So I just save my passwords and I'm straight into Talkspace. Saves time, the number of times people running around looking for passwords and things. So that's the 9 tiles on the front. And then there's various other bits I've got here. Useful links, patient information. This is quite nifty. So what I've done is just created QR codes for about 400 conditions now. Okay. One of the big issues you have with patient information leaflet is maintaining them. And these are just links to the NHS UK website. Okay. So if you press on the link, it opens the QR code. And the idea is you let the patient scan that QR code. It will open the appropriate leaflet on their phone, and then they can drop it as a tab onto their front screen. So it's greener. You don't need to deal with paper. It's quicker. The one thing they always have on them is, I'm pretty sure most of the information leaflets we give them, they throw in the bin as they walk out the department. But this way, it's always there. It's on their phone. They can read it whenever they want. They've always got it with them because they've always got their mobile phones with them. And when they don't need it, they can just delete it off their front screen. Events is just a calendar. So I just add in, if I'm aware of anything that's ED related, I'll add it to the calendar. And with that, I'll also add in the information about the event, how much it costs. If there's any programs, if there's a program available, I'll link that in as well. And if there's somewhere to book and pay, I'll add that link in as well. Again, so it makes life easier for the user. News is just sending out news. We don't tend to use that one too much because we use it elsewhere, usually with alerts. And the other one good thing is About Us section. And this is just putting a friendly face on us. So, where it says meet the ED consultants, we've just loaded information about all the ED consultants in there. So they see the non-clinical side of us, what our interests are, in the department, outside the department, and just putting that friendlier side of us. Because I'm sure some of us come across as quite grumpy and stern when we're at work. So I've done it, consultant responsibility. So that when we're looking to find out who's responsible for what bit in the ED, it's there, it's all available, it's quick. Our mentor lists are on there as well. So there's lots and lots of information. So that's just a whistle-top tour of what we've got on our app.
That's absolutely brilliant, Ash. And this is one of my favourite apps, I think, because there is so much quality content on there. Just a quick question. Have you had any feedback from colleagues who are using this? So, people that have been around the block a little while and have to do it the old way. And then similarly, perhaps, some of the new generation that, that are probably, hungry for solutions of this ilk.
Yeah, so hang on a second, Chris. I'm just going to show you. I just need to stop, or maybe I can override it. Okay, so I am just going to go to my home base and I will show you our data, which might actually show you. So the app went live in it's been about 18 months.
Yeah.
And I think the figures talk for themselves here.
Okay.
So this in April, so we're only halfway through April,
Yeah.
we've had 16,000 hits to the app already.
Wow.
So since it went live 18 months ago, we've had 280,000 hits to the app.
Wow.
And this is just from my staff, okay,
Yeah.
because it's mainly my staff who have access to the app. This is your dashboard. It is so easy to use. Those are the sections I'm showing you are these sections here. So that was the resuscitation guideline section. You can open it up. And the way this works is you need no IT training at all. It literally is, your options are cut and paste, drag photographs into it, hyperlink documents. And I think that's the main things. It's cut and paste, hyperlinks, PDFs, and obviously linking to videos as well. You can also hyperlink to other places in the app. So if it says go to section so-and-so in the app, you can put this hyperlink section into the app. It is so simple to use, it is unbelievable, which is what makes it a godsend.
So powerful, I think. I think the beauty is in the simplicity, isn't it, for these things? And it comes back to that, doesn't it? If we can make it easy for people, easy for your colleagues to manage and to access the information, but equally for people like your good self that have to, load the information on there and keep that thing updated. The easier we can make this, the better. I think everybody wins in that equation, doesn't it? Ash, yeah. I'm going to have to leave it there for now, if that's okay. We've got a bit of a sort of hard deadline that we need to go through. So thank you so much for your time again, sir. I really enjoy listening to you. The passion, and as I say, for the app, it's one of my favourites of our library. There's just so much good content on there, and you can see that you've spent, a good deal of time and effort ensuring that your colleagues have got everything they need. And hats off to you for that. I think it's fantastic. So I'm just going to share my screen just for the last sort of couple of slides here, just to round off. But Ash, thanks ever so much again. Really appreciate it. So as Ash was talking about the solution itself, I'm just going to give you a quick sort of insight into what that kind of looks like. So yeah, there's two aspects to it. You've obviously got the app itself. We can put in your logo. We're going to work with you, partner with you to understand what you're trying to do, what information you're trying to provide, who is your audience, and then come up with some kind of menu system that reflects your need, your requirement, your people. On the left-hand side here is the app itself. It's a web-based solution. It's on the cloud. You can access this from anywhere. So again, you don't necessarily need to be sat in at work, sat behind a computer. You can be accessing this from home, on the train, wherever you may be. You can pull this open on a tablet, on a laptop, even on a phone. It's a bit tricky on a phone, but you can open it up and then just produce that and distribute that content. This is a screen, if you can see the screen here, this is a typical screen with your typical editor. As Ash says, you've got a dozen or so different functions, all very simple, all the sorts of functions you're probably using within Word and PowerPoint anyway. So you're familiar with all of this stuff. The learning curve is really shallow, and you can be up and running in no time at all. Before we go, I'll just talk a little bit about the process. So what does that look like? Hopefully, by the end of this session, you've seen something that you like, you want to continue the conversation with us, we'll get back in contact. We'll be reaching out to you anyway, but get back in contact with us. Let's have a Teams meeting or a Google Hangout, whatever you prefer, where we can talk more about the challenges that you're facing and what you're trying to achieve. Beyond that, we produce a free trial. Seeing is believing, so we can put something together, we can create some logos, some branding, put some of your information in there, be able to give you the tool to be able to tell the story to your colleagues, to be able to show how this app can help within the team, within the department, how this app potentially could help the patient experience, or a bit of both. So we'll produce a free trial. It's a 30-day trial, absolutely no cost, no commitment from yourself, other than providing us with a bit of information, a bit of content, a bit of context, so we can produce this story for you and illustrate it within the app itself. Beyond that, I'm sure you guys are going to have to kind of go away and start talking to other colleagues, to leadership teams, to the budget holders, to be able to demonstrate how it works, how it fits, and what are some of the benefits. How's it going to help us achieve challenge X, challenge Y, challenge Z? What can it save us in terms of time and money, or how does it improve the patient experience? Beyond that, it's all about the the administration. Then let's get the agreement, let's get the the POs, let's get the invoices done, and then beyond that we can kind of kick off the project in lieu. We've already created a trial, so there's already something going. It's just on a bit of iteration between ourselves. We show you how to use the app, we get you up and running, and then we always take a back step and support you through the duration of the project itself. Now, as well as being quick and easy to use, and the trial process, it's quick and easy to procure, really. It doesn't cost a great deal, and it all depends on the number of users that you've got, the numbers of patients, the number of colleagues that might potentially download this. But if I give you a range, we're anywhere between £3,000 a year to £12,000 a year, depending on the number of users that are going to come and access this system. As Ash pointed out, you've got within the app itself a little analytics engine that provides you with an overview of how many people have downloaded the app, what sections they've been accessing, what information they've been viewing. So between us we can see and gauge the usage of the app, but anywhere between £3,000 and £12,000 per year, and it is really simple. In terms of speed, and it all comes back to quick and easy. It doesn't have to be a long drawn out process. One of our clients at the start of the pandemic came to me with a requirement that they needed to reach out to all the care home staff. They couldn't risk cascading important information down through the management team. They wanted direct communication links with all of their colleagues. So we produced an app. They came to us in the morning, and I think by late afternoon on the same day, the chief nurse there, or deputy chief nurse, was emailing the care home managers to provide instructions about how their teams can download the app. We did this within a day. It really doesn't have to be difficult. It really doesn't have to be complicated. The whole premise of this is quick and easy to procure, quick and easy to use, quick and easy for your colleagues, your patients, your audiences to whip out the phone and find the information they want when they want it. So with that in mind, we've got to go. We're on a bit of a hard deadline, unfortunately, today. So we have got some questions. We will put those together and some answers together and get those sent out relatively quickly. But thank you all for your time this afternoon. We wish you all the best, and we look forward to seeing you again. If you want to keep an eye out for the social medias, we'll let you know what the next Learning Lunch event is. Thanks very much for your time again, Ash. Much appreciated, and we'll see you all soon. Thanks for now. Bye-bye.